Allow me to tell you a bit about what hearing loss, dementia, and breast density have to do with each other. This past week, the FDA has put its final stamp of approval that requires, yes, I said requires, medical professionals to educate their patients on breast density. Why? Why'd they do this? Well, because breast density increases the risk of developing breast cancer by a factor of 2 to 4 times. And since not enough women were told this, were educated by their doctors about the correlation of breast density and risk of breast cancer, the federal government had to step in and now require doctors to talk to their patients about their breast density. Seems crazy, right? How could that many doctors ignore the data that indicates breast density increases the risk of breast cancer by 2 to 4 times? I mean, things got so bad and so many women were undereducated about breast cancer that the government had to step in. So now I ask you, how can so many in hearing healthcare ignore the fact that hearing loss has been shown to increase the risk of developing cognitive decline and dementia by, wait for it, 2 to 5 times? Ironic? Coincidence? I don't know. But the fact that the numbers are nearly the same should really leave an impression on you. The fact that breast density increases the risk of developing breast cancer, and the fact that hearing loss can increase the risk of dementia by 2 to 5 times. And the government had to step in to mandate that women be told about the links of breast cancer and breast density should really leave you wondering about the role of the hearing healthcare provider when it comes to educating patients on the links of hearing loss and cognitive decline. Look, it's been over 50 years since hearing loss was linked to changes in cognitive performance. It's been over 10 years since Dr. Lin taught us that hearing loss increases the risk of cognitive decline and dementia by 2 to 5 times. And over 6 years since the medical community published that treating hearing loss is the #1 modifiable factor for preventing cognitive decline and dementia. Yet, there seems to be some debate and even some attempt to redefine correlation and have the audiology community change its presentation of risk so as to not worry patients or perhaps overstate. Science matters, and I, for one, do not want the federal government to ever have to step into audiology and make us tell our patients something because we weren't doing it on our own. Yes, risk factors are not a promissory note. Yes, risk factors are not a guarantee. And yes, we are obligated to hold the welfare of each patient paramount and provide them with the education they need to make the best hearing and cognitive health decision for themselves. Without doing so, we are not telling our patients the full story, and they are left to make uneducated decisions about treatment.